welcome to episode 7 of Vetrap. Today we're in a somewhat different environment, mainly because my guest today is an incredibly busy man and never available during office hours, so we weren't allowed to go to our standard podcasting studio. But today I've got Dr Andrew Trezise with me. Hello, Andrew.
Hi, Chris. Hi.
And for those of you who don't know, Andrew is the father of Peninsula Vet Care, set up in 1980.
80.
On the nose.
June 30, 1980.
Yeah, okay. In a single small animal centre, originally just small animal centre in Dromana.
We did mixed.
Straight off mixed?
Yeah, we did mixed for 20 years.
So I've done my homework, obviously.
Yeah.
Andrew's actually responsible for me being a partner. Drafted me in 2011, 12, I think.
Something right there, yeah.
So I've got him to thank for that. But he's here today to talk primarily about how to survive your first year in GP veterinary practice. So this is aimed primarily at veterinary students, but young vets hopefully will have something to take away from it as well. Andrew is a past master of guiding young vets through their careers. There's been a lot of vets running through the Peninsula Vet Care group over the 44 years since its inauguration.
Yeah. It's been huge numbers.
Yeah. And Andrew, I have to say, to his credit, I would say has stayed completely up to date in his entire career, and still, even though he's retired, he's not. So he's still out and about doing locums and working for us and other people in semi-retirement in between golf rounds.
Playing a lot of golf. Doing a lot of holidays, playing a lot of golf. So it's been good. It's been good.
Yeah. Well, good to see you, Andrew. Welcome and thank you for coming.
Thank you. Thanks for inviting me.
So you've been out and about in GP locums this year much? Or?
Not very much this year. I think it's just quietened down a little bit in GP land, so not quite so much. And I've also been doing a lot of holidays and a lot of golf and things like that. Yep. So it sort of has to fit in with my schedule a little bit more, but I really enjoy coming into the practice and just catching up with the people that I've worked with for so long.
Yes,
I think that's a really big part of my life, and I've really enjoyed the journey. And I think when I did officially retire at the end of 2019, and that was it, I was going to hang up the stethoscope and I was done. I did, then COVID hit, and I didn't do anything for about 6 months, and then went and did a locum in New South Wales, and I just found that I enjoyed it again. I enjoyed it. I'd missed it, and now I just call in just for fun, just to walk around and say hi to people. So I really always miss the environs of being a veterinarian and the people that come with it. Pretty gutsy move you had. You set up Peninsula Vet Care, having had 1-2 years in clinic. It was 18 months after I graduated, and so I worked in 3 different practices, I think, in that time. One was on the peninsula, and I really loved it. It was a mixed practice, and I loved the area. I met a lot of farmers and things like that, and there was just this opportunity. I was frustrated where I was. I didn't like living in Melbourne at that stage, and it seemed that the Dromana was a great place to actually put a practice in. So we did that, and from inception, it was a profitable business. Yes,
yeah. And obviously you grew from there. Branches in, was it Mornington next? Or
Mornington in 84. And that was really just we wanted to get time off. I think the big thing with me, I worked 3 years, 24/7, so I was a bit loopy at the end of that. And I really just wanted time off. I took Peter Clancy in as a partner, and at that stage we thought a second practice was viable. It did take time to become viable, but we always had the base of Dromana doing very well. And that went really well for us.
So you've obviously stayed, and you obviously enjoy your veterinary career in whatever way it's taken you. Could you tell us really what you find that you most enjoy about being a vet over the years?
I think for me, it's the people. I think that if you interview a veterinarian to employ, one of my first things I'm trying to figure out is how much they like people. I think it's a very important part of what we do. And so I think that you need to enjoy your staff, the colleagues you work with, the vets, but also the clients.
Mm-hmm.
And I think that, I was never particularly good at leaving things at home, but I think once I got in that room, I was on song.
Yes.
And that was my comfort space. I was very comfortable in a consulting room.
Yeah.
And you always knew that if something wasn't going well or you didn't know what was going on, that you had, by then we built the practice to be as big as we could, to have other colleagues to chat to. I think one-man practice was really hard.
Yes. Yeah. And so for you, it's always been quite a sociable job, hasn't it?
Yeah.
That's fair to say.
Yeah.
And I think that is obviously a challenge. And I think for a new graduate in that setting who maybe doesn't have that personal confidence at that point, do you have anything that you can sort of maybe help with that in terms of, I've always felt that you to some extent you put a face on when you walk into the consulting room. You have to kind of forget what you might be thinking about anything before that, but when you come into the consulting room, you present a face that is friendly and cheery, even when you don't feel like that.
Yeah.
Do you feel the same way? Do you have any comments on how you achieve that?
Well, I think, I'm not naturally overt. I really have to not perform, but get out of my comfort zone. So I'm very much a person, if I saw someone in the supermarket, I might avoid that.
Yeah.
That contact. But where I'm confident, and I suppose that for me it was just a matter of talking to clients enough. My mantra when I became a vet was to make it that hopefully clients enjoyed the experience, but also a lot of vets of the day weren't very social. I wanted to get to know the people. So I think that was sort of probably why it was profitable from week one. People were looking for something else. And it wasn't particularly that I was any better. In fact, I was very young and I was making mistakes quite a lot. But you learn with experience, and I think it's really a matter of just being able to get across to people and being honest with them, and I think that worked really well for me.
Yeah, and I think being honest, I mean, if the first thing we would put as a point here is, to some extent, being a consulting vet, I mean, I use the word performance, you didn't. Well, I mean, for me, I think it always has been a little bit. I switch on the moment I enter
absolutely,
and I add cheeriness to my demeanour. If I'm at negative 90%, then it goes up to negative 50%. But at least it's an improvement. I can't always get all the way up to being super happy, but I do make a real effort, and I think that is appreciated by people. I think that's something that
I think when you and I worked together for a long time, and it would always be that if I went and got you, you would come into the room and be very confident and be very social. And I think that was the way we gelled. I think that was a good teamwork situation. And I think that, that one of my things is with vets, a lot of vets aren't particularly confident in discussing things with people. And that was part of the thing, is trying to get that up. And I think we achieved that with a lot of vets.
I think so, because I think a lot of vets are used, I mean, we're sort of, you take exams, you do well in your ATARs, and you're used to having all the answers because exams require you to pass them with the answers. And I think one of the things when you get into the veterinary career is that actually you suddenly realise that you don't. And quite commonly, especially originally in the first few months, you really don't have the answers. You're kind of really floundering, I think, sometimes.
Absolutely. And I think that's where, I started the practice after 18 months, and then there was no computer, there was no internet, it was books, and the books were out of date when they were printed. And I think that there wasn't a great camaraderie to a degree with other veterinarians that as much as what I would like or think there is now. We didn't have specialists to lean on. There was no orthopaedic surgeons. There was there was Rowan Blogg who did eyes, and that was about it. So you really did need to be able to feed off other people if you could, but it was harder then than what it is now.
And so the second thing would be, I think, use the staff that you have, and I don't mean just vets in that circumstance. There's a lot of veterinary clinics will have nurses that have a lot of experience, and I would suggest that a tip for a new graduate would possibly be that they should make their nurses their friends as quickly as possible.
Absolutely. I think that the nurses, I remember the first day of practice, I had an abscess and I didn't know what to do with it. It was just an abscess on a cat. Very simple.
Not you personally.
No. And the nurse said, this is what we do. Yeah. Now, it wasn't very difficult then, and it was, but you did lean on those people, and nurses have got a very different skill set to what we've got as well. But I think they're so important. And for me, getting past those first few years, they were really important. But then, I was employing new nurses at that stage that didn't have experience. So it then fell back onto me, and that was probably a lot of the stress level. Yes.
You've had a method of getting to know people in practice through your career that I think I've looked at, and it comes across so naturally, but actually there is a secret you have. You actually write notes on the people you meet a little bit, don't you?
A lot. I think that what I do say to people if they're consulting is, especially if as a new veterinarian in a practice where you haven't got rapport or you haven't got a reputation or you haven't been there at all, is to get to know the people. And so my first question might be to a person, how's your day been? And then they'll start to say, well, the dog's not feeling particularly well. And so I'm not talking about the dog right now. Let's talk about you and how are you? Because I think it's really important to gauge the client's mindset as you enter a consultation or very early in that piece, so you know that they've either had a really bad day or they've had a great day, and then you can sort of temper the conversation a little bit to how they are feeling. Yes. I involve children. I find out a lot about kids, what footy team they barrack for.
I do remember that. I remember seeing some barracks for Geelong, and I'd written on the client notes on RX Works that they were just there. So next time you go, you can say something about it.
That's right. And I think the clients appreciate that that they've got maybe 3 kids. But I think the important thing for me is that first 2 to 3 minutes is getting to know the client. And then say, okay, because we can only diagnose things fairly quickly in GP land. There's only maybe 1 or 2 serious cases a day at most. A lot of it is vaccination, things like that, and or ears or skin or something of that nature. And I think basically, therefore you've got a little bit of time to get to know the client. Yes. I think, and then they get confidence in you to a degree. To then, if you say we need to do this, and I think that's one of the things I say, we need to do this. We need to do a blood test, or we need to do an X-ray. Not, do you think you'd like to do a blood test? They don't know. Yes. And I think that's where we need to guide them as much as we can.
Yes. Yeah. And you're right. I think there really are, in a busy, maybe 20 consults in a day. I mean, these days, even more than ever, what you're talking about, you have time for.
Exactly.
Because actually now I remember my second job, there was 15-minute consultations, and they were called A consultations. When it got busy, they had B consultations. All of a sudden, everyone who's paying the same amount of money was then getting a 7.5-minute consultation. And if it got really busy, C consults were booked, and they were push everything down to 5 minutes, and you had to rattle through everything in 5 minutes. That isn't the service of the modern veterinary practice, is it?
Not at all. And I think when I went to the UK in '96 and did locuming there, they didn't have an appointment system, and then you would go in with one dog, you'd be diagnosing whatever it was. One particular dog I remember had laryngeal hemiplegia. I've come out from what was a reasonably extended consultation with this person, and there were 12 people waiting. There was no one when I went in with that dog, and that was frightening. Yes. And that was like, you didn't have time to build any rapport with clients. It was just getting through it.
Yes.
But I think that because now with sort of maybe 20-minute consultations, sometimes there's a nurse in the room, which I like, or we've got 30 minutes for doing, an initial client or a vaccination that's a young puppy, or, an ear or skin or whatever it might be. You've got time to talk.
Yes.
Yeah.
And I think it doesn't take very long to spend that time to make the effort to kind of engage even just a little bit, and it does pay dividends for everything.
Totally agree.
Yeah. So moving on to those 2 difficult cases that you're going to see a day. Now, sometimes they're not going to be emergencies. They're going to be something that was maybe booked the day before.
Yep.
So one thing, actually, I was talking with a couple of colleagues at work about this conversation, and one thing that someone said I thought was very useful was perhaps the kind of be prepared thing, where if you have a day sheet written down, you can have a look at some of those, and often the receptionist, certainly in our practice, will say dog's coughing or whatever, something about that consult that's coming in, or you may have a history already there that you need to sort of read up on. you can be a little bit, spending half an hour the night before on the day coming can actually prepare you quite a bit for what's coming, and give you a feeling of confidence that you've actually got some information at hand.
Yeah, well, even now, I think when I locum, if I'm locum one of the PVC sites or whatever, I'll go in the day before. Very often it'll be on the way home from golf, but I'll call in and have a look at what's going on.
Yes.
And I think I'll read the first 3 or 4 or 5 consults,
yes,
so that I'm prepared and nothing's going to throw me.
Yeah.
And if you know you've got something which is a chronic diarrhea, or you've got something which is maybe a little bit more involved than some of the other things, then you can sort of think about that a little bit before you approach it and read the history that's already been done, because that's what you don't have time is. Because if you get an emergency, you don't have time then to read it. So when I do locums that are external to that, and I did one in Bendigo the other week, then I would always come in early and start reading and read up. And if I had time, I'd read the next day.
And that's Andrew, who's been doing this for a while, folks.
Yeah,
he still does that.
Yeah, absolutely. So the other thing I was going to sort of say is that I think it's really important to, one of my colleagues always said that there's a problem if there's 3 of you in the room. Well, his definition of an emergency was that there are 3 people in the room, or 3 beasts in the room: the dog or the cat, the owner, and you. And if you don't know what's going on, get the dog out of the room. Now that might be just to take his temperature, get a urine test. If you don't know what's going on, I think the really important thing is not to say, I really haven't got a clue what it is.
Yes.
I think it's important to say, look, I just need to get a urine sample, or I want to take the dog out and just, get the nurse to hold so I can examine this ear. Yeah. And then you can get someone else's ear and go back in with confidence that this is how we're going to treat it.
Yes.
So I think it's a really important trick in the early days is not to be afraid to admit that dog, even if it is for the day, to get a urine sample or whatever it might be, or a couple of hours, or come back in a couple of hours. You've then got it all nutted out.
Yeah.
You've got that help. Yeah. That's really important.
I think it is. And I remember when you and I used to work at Dromana, we'd both do that all the time. And I think that's we're trying to list points that we're trying to get across, but I think this is another point, is that you're not expected to know everything in the consulting room, are you? And even after you've been doing the job for as long as you have, and with the experience that you have and qualifications, or everything else, you're still going to come across something that looks unusual. And that, it happens in ERH with Arthur and Al and Denise and I. We will still do the same thing. We will still take a dog next door, and I'm just going to ask, we actually say it. I want someone else's eyes on this. Yeah. And I don't think that there is a reasonable client in the world who would hate that thought that you are going to ask advice of a colleague.
Yeah, I think the other way of doing it, I sort of said never potentially say I don't have a clue what's going on, because they will lose confidence with that. Yeah. But I think it is a matter of sort of going, I wouldn't mind Chris having a look at this, or I wouldn't mind someone sort of medically, or Susie or whatever it might be, or Vanessa. Yes. It might be someone who's just experienced in that particular area. Yeah. And what the beauty of practice is now, we've got a lot of people that are subspecialised or have a special interest in different areas, and mine obviously is skin. So I think in some respects, I'll always walk out of a room and someone might grab me and say, what do you think about this here? Or what do you think about this cytology? Or what should I do with this? And I think that's the beauty of today's practice, really. So I think veterinarians today are really lucky.
Yes.
I know the expectations are much higher. The expectations were very low when I started.
Yes.
If I did something wrong, that was part of the deal.
Yes.
You did your best.
Yeah.
But I think now the expectations are high, and that's why it's not so much you have to refer everything. I think it's a matter that you probably need to get to the bottom of it, and I'm very prepared to ring someone to get the answer. Yeah. And I did that when I was doing that locum in Bendigo. I rang ERH. There was a couple of tricky cases, and I was going solo, so I rang and we had the results.
Yes. And that's, again, looking back at the performance aspect of being a vet, you don't have to have all the answers, but you have to show that you're trying to get them.
Exactly.
You have to show that you're engaged and interested.
Yeah.
And put that across. And if you can put that across, then there's a whole time scale reduction, because you've got, this is interesting, I'm not sure, whatever, or you're going to even say, like, I just want to take a urine sample, or whichever it is that you choose to go down that route. Yeah. But the engagement and the process gives you time to think about those cases.
Yeah,
right?
Absolutely.
Yeah.
So yeah, I think, I'm very prepared to ring someone. And I think if you say to a client, I'm going to ring someone about this and we're going to talk about it later. This is a bit complicated. I haven't got all the answers yet or now. Then I think they really appreciate it. And I was doing that. I do that in all my locums now.
Yes.
Because I have to go in. I'm going in. I haven't got the reputation that I have at PVC. No one knows me if I'm going to an external locum. Yeah. So I've got to get across very quickly that I know what I'm doing. But also if I don't know what it is, I'm going to find out.
Yeah, absolutely. So out of the consulting room for a minute, we could possibly talk about how to choose a practice to work at.
Yes.
Obviously, Peninsula Vet Care is a fantastic employer and
brilliant,
second to none in the workplace, and etc. But obviously, it's a challenging moment when you are perhaps going to interviews for the first time in your career, and so how would you feel about? I mean, I've conducted interviews with you in the past.
Yep.
For what would you look for in a new graduate coming through?
I think the CV initially has to be impressive because we used to get a lot of CVs. I always kept CVs. I never threw them out.
Define an impressive CV.
Beg your pardon. Define it. Yeah. Bullet points. 2-page maximum. Good logo, good, something on the top, something maybe down the side, a few paws down the side, whatever it might be. It has to be that you get across what the battle's been to get through. I mean, I want to know if you've worked part-time at McDonald's. I want to know if you've done some hard yards to get through. And I want to sort of know what your interests are, whether you've been, good at sport, whether you're coaching at sport, whether you had a mentorship role, anything like that would stand you out above the rest. And we've had those people through. Yeah. And even if we haven't had a job, I've kept the resumes of those people and I've gone after them 18 months later when we're ready. Yeah. I think that I went through a stage where I interview everyone and rather than say, we haven't got a job right now, thanks very much, we'll see you later. Yeah. I think it was extremely important to offer an interview, even if there wasn't something there. And we got vets from that.
Yes.
Because next week, you never know what's going to happen next week.
Yes.
And so you would pick up the phone and go, that job's there.
Yes.
So I think, I'm looking for a bit for ambition. I'm trying to find a little bit whether they've got a special interest. And, are they surgically inclined? Are they medically inclined? Where do they see themselves in a couple of years' time? That sort of thing.
Yeah. And from the other point of view, like if you're a new graduate, remembering back then,
goodness,
what would you think is a good practice to choose? If you're in a lucky position where you've got a few odd jobs which you could go for, and could you think about what's practice you maybe think is the right one to go for for a new graduate?
Well, I've always said, and I think we do see a lot of veterinary students through our practice, and I think when you're talking to those guys, one of my major things is to tell them to go to a good practice first. Spend the time to get into a good practice where you will be well mentored, where there is potentially someone who's been around it for a while but also has a degree of excellence in certain areas if they've got a few. Yes. So I think 3-4 vet practices are probably ideal. Definitely. Compared to if you're going into a single man practice and you're the second cog in a practice where someone's maybe my age now, it may not be the best place to be.
Read between the lines, you're there to create holidays for the person who should be mentoring you. It's true, is it not?
It is.
I was once offered a residency for exactly that purpose.
I think that my first practice, it was really hard.
Yeah.
It was just one-on-one, and there was a lot of times when I was by myself, and I was a new grad, and that was very hard, especially in mixed.
Yes.
So I think that I always sort of indicate to a lot of the new grads coming through, do your homework, find out who are good practices to work with. But you can always get a really solid base. I just think you want to go to a bigger practice if you can, where there's a degree of skill set.
Yes.
And you're not going to get thrown in at the deep end, but you want to get exposure as well.
Yes. And the feeling perhaps that if you're going for an interview or you're meeting the owners or the senior vets at that practice, that they are already talking about how you're going to be supported.
Yeah.
Because Otherwise, if that's not coming across, my first practice was in a mixed practice in the Lake District in England, with 2 partners and 2 assistants. That was the thing, and it was a 2-in-4 roster. So you were on first call and second call, and then you had 2 nights off and like that. I always worked with the same. If we were first and second call, I always worked with the same partner. We got on very well, and he basically mentored me for the whole of my time there. And that was clear from the outset. Like, it was really obvious that was going to happen, and it did.
Yeah. So I think obviously vets have been on the front foot asking us what we're prepared to do for them too. And I think that's an important thing to ask if you're a new grad.
Sure.
We've had many vets that I think we've employed over the journey that have gone to another practice, been unhappy. We've interviewed them at some stage and they've rung us up and said, look, I'm not happy where I am. Can I come and see you guys? And I think I'm on a Facebook page, and it was really, someone was asking, do I go and present myself at a practice? They're not advertising right now, but do I just go and do it? And my answer would be always, because you don't know what's going to happen tomorrow. And I want to see you in person. And if someone came in with a CV and, they'd rung and, they might get put off by the receptionist or whatever, I would always try and see that person or say, can you come back during my lunchtime, we'll have a chat. So, and that might be a nurse or a vet. And I think it's really important to do that. So I think that, then you should be able to judge a practice that wants you. And so, I think that's really important.
So I think it's possible to, at an interview, if you're going to a practice, it's possible to say to the person who's interviewing you, have you got any questions? Well, yes. Is it okay in your practice for me, for example, to take a dog out of the consulting room and ask advice from another? Is that okay? Is it okay for me to leave the consulting room and find a vet who may be free and bring them in? It's okay to ask those questions.
Yeah.
I mean, I personally, if a new graduate asked me that in an interview, I'd be rapt. I think that's really, it shows that we're thinking already about how the practicalities of actually how you're going to be mentored and how that is going to work. And if you're asking that question, you're sort of expecting partially that maybe it's the person might say, well, no, I think you'd be professional. You clearly should stay where you put and do your job. In which case you've asked a question that has clearly told you what you need to know about what sort of mentor quality you're going to get down the track.
Yeah, so I think the other thing I think is really important is to see your own clients back. I know I'm switching tack a bit here,
absolutely.
but it just went through my mind. And I think that, I get quite annoyed if I'm seeing someone's dog from the week before and they're actually working tomorrow.
Yes.
Why haven't they said, I want to see you back in 8 days, I want to see you back in 9 days? Take ownership of the case and aim for a positive result, because that's the way you build your client base. You don't build it by giving it off to the next vet and not really caring as to how that dog's gone. I think it's very important to ring clients and say, how is Fred going after 2 or 3 days? I think they're the things that are really build the relationship with you and the client. And at the end of the day, the dog is, or the cat is going to be happy that you're doing that as well. But I think to get a positive result, you always want to get a positive result. And I don't care how many doors you need to go through to get that. That's what you need to do.
No, and I think getting a rapport with a client, if you see your own cases back, like there's only so many hours in the day. So you're going to see clients and you're going to see them as revisits. They're going to be people you have already put the effort in to make that rapport. So you're going to spend more of your life talking to people you already know a bit, which actually makes it easier.
Yes. It makes it very easy to not be re-diagnosing, because I think, and you'd be the same as me, if I see a lameness that someone else has seen a week before, they might have thought, it was a toe or whatever it might be. I don't pay attention to that. I do my own workup, and it might actually be that it's something else.
That could be another point, is that when it is worth, when you're seeing a case for the first time, always imagining that it's the first time that case has been seen.
Absolutely. I don't think ever go by the fact that someone said it's this.
Yes.
It might be easy to follow up an ear and say, okay, we had rods in the ear or whatever it might be, and this is what's going on. But I think if you've got a medical issue or a lameness or whatever it might be, you need to go in with new eyes.
Yes.
And I think that's a really important thing to do because, as you know, and you've done it and I've done it, you've picked up something which the other vet hasn't.
Yes.
And I think that's really important. So, but if you're doing a revisit, it's your case. But you then need to re-examine as if it's brand new again, unless it's right, unless it's fine.
Unless it's fine, you have to switch and go again. It's very hard to do.
Yeah.
It's very hard to look at a case without that preconceived idea of what you thought last time that it was.
Well, it's like getting a blood result saying, someone, can you report the bloods for me tomorrow, and you haven't seen the dog. I find that extremely difficult.
Yes.
So I would rather say, I'll ring you in, if it's not urgent, I'll ring you in 2 days about that blood result rather than fobbing it off to someone else. So I'm a very anti-fobber.
Yes.
I don't like people that fob or don't care.
Yes.
I think it's really about caring.
Yeah, yeah. So and I think that and showing that you're caring.
Yeah.
Because you may well care, like if you're nervous about something, that typically shows that you care about it.
Yeah.
Right. So,
and I think a lot of vets do care, but they just don't get it across.
Yes.
And that can be, a little bit of anxiety. Or they'll dwell on the issue. They might have, misdiagnosed something, and they'll dwell on that for a period of time.
Yeah.
Get over it. You're not going to be perfect.
Yes.
No one is.
No one
is, and no one doesn't make a misdiagnosis at some stage.
Yeah.
But I think that we're graduating some very high ATAR veterinarians, and they're very academic. And as you said before, they're not used to, actually making a mistake.
Yes.
I think you've got to get through that process and go, these are the ways to avoid those mistakes, is what we've talked about.
Yeah. And I think in a lot of ways, the veterinary profession as a whole is an more imperfect profession than a lot of other professions are. Like there's fewer guidelines for you on a day-to-day basis. I think you're not as it's part of the joy of the profession, but it's also part of the challenge when you first start that things are going to happen that you didn't expect and don't go according to plan, and there's more issues behind doing the right thing medically than just doing the right thing medically. There may be cost issues or previous experiences that those people have got that they're worried about vet care altogether, or those things that are in there.
I think that I've always said, if you need to do something and it's stopping you from doing a proper job, sometimes you just do it. And if you don't charge it, it's not the end of the world. And I know people don't like hearing that, but sometimes doing something for nothing is a very good thing to do. And I think that, it's sort of like, okay, if I said to you, it's going to cost you so much to do cytology, do you want to do that or not? And they go, well, I'd rather not. I'd rather you guess.
Yes.
Then I'm probably going to, I don't actually ask that. I just do the cytology.
Yes.
But I think that basically, the more you put in front of the clients, it's going to cost you this, the less likely they're going to, if you give them an option, A is, this best medicine or whatever it might be, and we talk about that. But I think it's really important to sometimes, some people are really struggling, and we're finding right now it's struggle town out there.
Yeah.
And I think it's really important to, again, read the room and be able to sometimes give something.
I absolutely agree. Although for a new graduate, that's maybe not a decision they can necessarily make.
They can't, but I think sometimes it's sort of, if they came out of the room and said to me, look, I'm struggling here, I would be going, okay, just do it. And I think we've built a big practice on that basis.
Yeah, and I can't deny, literally within 48 hours of this discussion in the last couple of days, there was a dog with a fracture, a little puppy, that had an x-ray that showed maybe a couple of fissures that were looking like they might get close to the joint. There was quite a strict estimate on that case, and it might have gone through the CT scan without much of an additional charge.
That's right.
Just to make absolutely certain that we were going to do the right thing when we got the
I think that's important. It comes back, time and time again. If you do the right thing, if you're guessing, there's good medicine, there's bad medicine. There's no such thing as good cheap medicine. But I think you can also say there's no such. If you need to do something, go and ask your boss. Look, I'm really struggling with this client. They're really financially strapped. Can I do this and maybe not charge for it? Some of the bosses won't do that, but most will say, I think that's fine. Let's just do it. Let's get it right.
Yeah, I think so. Well, I think we were veering dangerously close to veering off message there slightly. did happen. It does happen occasionally.
It does, yeah.
So look, I mean, I'm not sure at what point we're going to wrap this up, because I think we could probably talk about this topic randomly and ramblingly all night.
Yep.
I hope you've found this episode useful. If you've got any more questions, as always, you can contact us on an email address that I am currently struggling to remember. I'm sure it'll be written on the screen somewhere around me at some point. And if you've got any suggestions for the podcast that we could do, please also reach out and put them forward, and we'll get hold of people. And if there's anyone else you'd like to hear from, or if you'd like to hear from Andrew again for more wise, sage
Not likely, yeah.
information, then we can definitely do this again.
We could do something on ears, or something
really
stimulating like that, or my pet subjects. We won't go there, but I think we could do something like that.
Andrew's had a lifelong interest in dermatology for some reason. I'm not sure.
No, I'd nearly, if I could have afforded, I probably would have done dermatology as a speciality. Yeah. But I was in a practice where you can't go back. It's really difficult to get out of that. Yeah. Kids are of an age. I was 40 when I was thinking about that. So I think that basically, I have a special interest in that. I think there are many suffering dogs out there, and cats, and I think if we can make their life a lot better and less itchy or whatever it might be, then that works for me.
Yeah. And that is the final tip, I think, of this session is maybe developing a special interest.
I was going to get there. Yeah.
Is actually a very useful tool, because you will find, especially going maybe into second year, you're starting to see more cases. If you make an effort in that field, you'll see those cases. People who don't like that field will very, very happily push those things in your direction.
Absolutely.
And when you've got a 4 or 5 vet practice, that's going to work for you much better.
I think you want to make yourself a little bit indispensable or very employable. And I think that comes with maybe eventually, and we talked about, memberships and things like that. Now, I've never achieved a membership because that wasn't my era, but I think now it is. And I think that that's something which I actively encourage people. So if I'm talking to, pre-vets or new grads, I'm saying, what's an area that you would be prepared to, do further study in? Because I think it's going to be important. If you find that in the practice, like if you've got 4 ultrasonographers in the practice, maybe that's not where you're going to push, but I think it's really important to get really good at something.
Yes, yeah, absolutely. And with that, thank you very much for watching and listening, and we'll see you next time.
Thank you. Thanks very much.
Andrew.
Thank you. Bye.
And that's a vet wrap. Join us fortnightly for these podcasts. You can access them through our YouTube channel, Vet Education Hub on the Peninsula Vet Care Emergency and Referral Hospital website, and all other platforms that you can source your podcasts.